Hey, future nurses out there.
Yeah.
We're tackling something you'll definitely need to know, disaster preparedness. And we're not talking about like your basic earthquake kit here.
Right. This is about how hospitals prepare for any kind of major emergency.
Exactly. We've got this presentation called Emergency Operations Plan and Disaster Preparedness.
Mm.
It's made for nursing students, so it's perfect for our deep dive today.
You know, it's amazing how much planning goes on behind the scenes for stuff you hope never happens.
Yeah, so let's get into it. First up, the Emergency Operations Plan, or EOP. You probably heard the term. What is it in a nutshell?
It's basically the hospital's game plan for handling any emergency. A giant document that covers everything.
Like who's in charge and where the extra supplies are.
Exactly. And it's not optional. The Joint Commission requires every hospital to have this.
No excuses.
Right. It's not just for natural disasters either. Think active shooter situations, biohazard spills, even big power outages.
Okay, so it's like the hospital's superhero manual. Got it.
Hmm.
Let's break it down. The presentation lists 6 key parts. Starting with the communication plan, super important when things are crazy, right?
Absolutely. It's how info flows within the hospital and to outside agencies, like EMS fire departments, other hospitals.
To make sure everyone's on the same page.
Right. Imagine trying to coordinate hundreds of people during an emergency without a clear communication plan.
Okay, yeah, don't want to think about that. Next up, resource management. What does that cover?
It's about making sure you have what you need when you need it in a disaster.
So medical supplies, obviously.
Way more than that, staffing bed capacity, even things like food and water if people are stuck at the hospital.
That's a good point. Okay, what about safety and security?
That covers a ton of stuff. Unauthorized access to the hospital, potential violence, or looting after a disaster.
Makes sense. And things like evacuations or shelter-in-place protocols too,
Yeah,
right?
exactly. And there are those sensitive areas you mentioned, like the pharmacy, the lab, places where security is super important.
Right, you don't want someone walking off with all the morphine when things are already chaotic.
Exactly. The EOP has ways to control access to those places.
Okay, so communication resources, security checked. What's next?
Staff responsibilities. Your regular nursing duties might completely change during a disaster.
Like you could be doing triage or helping with logistics.
Exactly. It all depends on what's happening and what the hospital needs at that moment.
So flexibility is key.
Got it. What about utilities management?
That's about keeping the hospital running, even if the power or water goes out.
Oh, yeah. You can't exactly do surgery in the dark.
Exactly. The EOP has backup plans for all of that stuff.
Okay, so that's 5 down. One more core component of the EOP. What is it?
Patient care, which might seem obvious, but it gets way more complex in a disaster.
We're talking triage, surge capacity, making sure everyone gets care, even when things are totally overwhelmed.
Exactly. And it can lead to some tough decisions when resources are scarce.
Okay, so that's a good overview of what the EOP is. But when would a hospital actually activate it? It depends on the situation, but it could be anything from a natural disaster like a hurricane to a man-made disaster like a terrorist attack.
Or even a huge infectious disease outbreak.
Right. The decision is based on how bad things are and how much the hospital and the community might be affected.
Makes sense.
Hmm.
So who actually makes that call to activate the EOP?
Usually it's senior leadership or a special committee that's in charge of emergency operations.
So they're watching the situation and deciding if it's time to put the plan into action.
Exactly.
Okay, so let's say they do activate it. What happens then?
It's all hands on deck. Everyone follows their assigned roles. Communication systems are activated, resources are mobilized.
And patient care protocols change based on what's happening.
Right. There's an incident commander who's in charge of overseeing everything.
Like the conductor of an orchestra.
Exactly. But it's not always a perfect symphony. You have to be flexible and adapt to the situation.
Because no plan is perfect, especially in a disaster.
Right. You have to think on your feet and work as a team to overcome challenges.
Okay, so we've covered the EOP from start to finish. Now let's focus on what nurses specifically do in all of this.
Okay, let's do it.
Triage is a big one, and probably the most stressful section. You might have to make life or death decisions under pressure.
It's about quickly assessing patients and deciding who needs immediate attention.
Often with very limited resources.
Exactly.
Right.
You have to use your judgment and consider things like vital signs, level of consciousness, the type of injury.
And how many resources you have available at that moment.
Oh, right. It's a lot to think about.
And triage isn't a one-time thing either. A patient's condition can change quickly, so you have to keep reassessing.
Absolutely.
What about communication? That's got to be even harder in a disaster when everything's changing so fast.
Communication is key. Nurses have to relay information between patients, families, other healthcare providers.
So you're communicating with everyone.
Exactly. And you have to be clear, concise, and accurate. Lives depend on it.
And even in the chaos, you can't forget that these are people who are scared and traumatized.
Right? Psychological support is a huge part of disaster nursing. You have to be that calming presence.
Offer reassurance.
Yeah.
Explain what's happening.
And be able to recognize signs of stress and trauma in both patients and your colleagues.
So you're not just a medical provider, but a source of support too.
Exactly.
Okay, so triage communication, psychological support. What other roles might nurses find themselves doing?
You could be involved in evacuating patients' decontamination procedures, even helping with logistics or crowd control.
Wow, so it's really all hands on deck. You have to be ready for anything.
Exactly.
And then there's the ethical side of things, which I think we need to talk about. Disasters force us to make some really tough choices.
Absolutely. And those ethical dilemmas are even harder when you're dealing with limited resources.
Like when there aren't enough ventilators or ICU beds for everyone who needs them.
That's one of the toughest things to deal with in a disaster, deciding who gets treatment and who doesn't.
And it's not just the big stuff. Even things like bandages and pain meds can become scarce.
Right. Those decisions might seem small, but they can make a big difference for patients.
And it's all happening under incredible pressure.
Yeah.
You don't have time to sit and think things through.
Exactly. It can be really emotionally draining.
And then there's the question of triage again. Is it always about saving the most lives?
That's a tough one. Triage protocols are supposed to help you prioritize, but sometimes the situation forces your hand.
You have to make difficult decisions about who gets treated first.
And no one takes those decisions lightly.
And then there's the idea of duty to care. As a nurse, you want to help your patients, but what about your own safety?
That's another difficult balance. You might be asked to put yourself at risk, and you have to think about your own family too.
It's a reminder that you're not just a nurse. You're a person with your own life and responsibilities.
Exactly.
Okay, let's move on to something a little less heavy PPE. You've probably heard about those different levels, A, B, C, and D, but what do they actually mean?
Choosing the right PPE is super important, especially when you're dealing with hazardous materials.
So level A is the highest level of protection.
Exactly. It's like a full-body spacesuit with a self-contained breathing apparatus.
For when you might be exposed to really dangerous stuff.
Right, like chemical spills or radioactive contamination.
Okay, what about level B?
Still high respiratory protection, but not as much skin protection. You'd have the breathing apparatus, but the suit wouldn't be fully sealed.
So when you know what you're dealing with, the skin absorption isn't a big risk.
Exactly.
What about level C?
That's when you'd use an air-purifying respirator and protective clothing.
So you're protected from both inhalation and skin contact.
Right.
And level D is the most basic level.
Yeah, that's your regular work clothes and maybe some basic gloves or a mask.
For everyday stuff when there's no specific hazard?
Exactly.
Okay, so it's all about assessing the situation and choosing the right level of protection.
Right. And you need to know how to use the equipment properly, too.
It's not just about throwing on a mask. There's a technique to it.
Exactly. And you need to know what to do if your PPE gets ripped or damaged.
Because that could expose you to whatever you're trying to protect yourself from.
Exactly.
Okay, let's talk about decontamination. That seems pretty straightforward, but our source mentioned some things to watch out for.
Decontamination is super important, but it's not always perfect.
What do you mean?
Well, it can be really hard to completely decontaminate an area or a person, especially in a disaster with hazardous materials.
So there could still be some risk, even after decontamination.
Right. That's why you have to stay vigilant about using PPE even after decontamination is done.
And make sure patients understand that too.
Absolutely. Patient education is key. You have to help them understand the risks and what they can do to stay safe.
Okay, we've covered a lot in this first part of our disaster preparedness deep dive. The EOP ethical challenges, PPE decontamination.
We're just getting started, though. Stay tuned for part 2, where we'll dig even deeper into the nurse's role in all of this. Welcome back to our disaster preparedness deep dive. We're really getting into what it's like to be a nurse in these situations.
Picking up where we left off with the nurse's role in all of this.
As future nurses, you'll be right there in the thick of it, so knowing your hospital's EOP is super important.
It's like your survival guide when everything's going crazy.
Exactly. But let's be real, textbooks can only teach you so much. We're going to get into some real-world scenarios and practical tips
to help you connect the dots and feel more prepared.
You know, disaster preparedness isn't just about memorizing rules. It's about thinking on your feet and being adaptable.
And having compassion for your patients and colleagues.
Exactly. And remembering that you're part of a team, you need to communicate and support each other.
Okay, so let's get into it. Imagine you're on the night shift in the ER, and suddenly, bam, a major earthquake hits.
Power goes out, alarms are going off, and patients are coming in with all sorts of injuries.
What's the first thing you do?
Your training kicks in. You remember those EOP protocols? First priority is safety always. Yours, your colleagues, and your patients.
So you make sure everyone's okay and there were no immediate dangers.
Right. Then it's all about communication. You check in with your team leader, report any problems, and follow their instructions.
Because the EOP outlines everyone's roles and responsibilities.
Exactly. You have to maintain clear communication even when things are chaotic.
Okay, so safety first, then communication.
Got it.
What if you're assigned to triage?
You've got a ton of patients, all with different injuries and limited resources. How do you decide who gets treated first?
This is where those triage skills come in. You have to assess each patient quickly.
Check their vital signs, level of consciousness, type of injury, anything that's life-threatening.
And decide who needs immediate attention.
Exactly. And you use those triage tags, red for immediate yellow, for urgent green, for minor and black, for unfortunately those who are unlikely to survive.
That's a lot of pressure.
It is. But it's about making sure the most critical patients get care first.
And don't forget about the emotional side of things.
Right. People are going to be scared and traumatized. You have to be there for them.
Listen to their fears, validate their emotions, offer reassurance.
Even just a kind word or a touch can make a difference.
And don't forget about your colleagues. They're going through it too.
Absolutely. Check in with each other. Offer support. A little humor can help too.
Okay, let's switch gears. What if you're in a small hospital and there's a chemical spill in the community?
Now you're dealing with hazardous materials. You need to know what chemical it is and what the health effects are.
So you can decide what PPE to wear and how to treat the patients.
Exactly. And decontamination becomes even more important.
But it's not always a perfect solution.
Right. Some chemicals can have delayed effects, or you might not be able to remove all of it.
So you have to be really careful and follow the protocols.
And make sure patients understand the risks and what they can do to protect themselves.
Now imagine you're in a big city hospital and there's a mass casualty event.
Could be anything. A terrorist attack, a huge accident. The ER is flooded with patients, and you're short on resources.
Talk about pressure.
Huh?
How do you stay calm and do your job?
You breathe. Take things one step at a time. Rely on your training and your team.
Communicate clearly with your colleagues. Ask for help when you need it.
You can't do everything on your own, and that's okay.
It's all about working together.
Exactly. You're stronger as a team.
Okay, this has been intense. But it's just a taste of what disaster nursing can be like.
There's always more to learn. But the key takeaways are to never stop learning. Embrace the challenge and remember the human element.
Because that's what makes nursing so special.
And don't forget to take care of yourself. You can't help others if you're running on empty.
Okay, stay tuned for part 3, where we'll give you even more resources and tips for thriving in this field. And we're back, wrapping up our disaster preparedness deep dive. You've learned about the EOP, those tough ethical decisions, and even how to suit up in all that PPE.
But now we're going to talk about resources, things that'll help you put all this knowledge into action.
Okay, give us the goods. What resources should nursing students and new grads check out?
Well, first off, don't forget about those big organizations, FEMA, the Department of Homeland Security, NIMS.
Right, NIMS. That's the National Incident Management System.
Exactly. Their websites are like gold mines for disaster preparedness info.
Planning templates, training materials, case studies, best practices.
All there. You can learn a ton just from browsing those sites.
And it's all free.
Exactly. But don't overlook the resources in your own community, too.
Like what?
Local hospitals, health departments, community organizations. They often have disaster training or volunteer opportunities.
Oh, yeah. That's a good way to get hands-on experience.
Exactly. Plus, you can meet people who work in disaster response and learn from them.
Networking is always a good idea.
Absolutely. Okay, so we've got the big organizations and the local resources. What about nurses themselves? What can we do?
Yeah. How can we be more involved in disaster preparedness?
Nurses have a huge role to play. You're not just caregivers, you're also educators and advocates.
We're the ones on the front lines. We see what works and what doesn't.
Exactly. You can use your voice to advocate for better disaster preparedness in your workplace and your community.
And we can help educate patients and families about how to be prepared.
Absolutely. It's all about empowering people to take charge of their own safety.
But let's be real. Disaster nursing is tough. It can take a toll on you.
That's why self-care is so important. You have to take care of yourself so you can take care of others.
Right. You can't pour from an empty cup.
Exactly. So as we wrap up this deep dive, I want to leave you with a few key things to remember.
Okay. Hit us with your wisdom.
First, never stop learning. Disaster response is constantly evolving, so stay curious and keep learning new things.
And don't be afraid to embrace the challenge. This is a tough field, but it's also incredibly rewarding.
You'll learn so much about yourself and what you're capable of.
And finally, never lose sight of the human element.
Remember that behind every disaster, there are people who are hurting and need your help.
That's what makes nursing so special. We're there for people when they need us most.
So to all you future nurses out there, go out and make us proud. You've got this.
And we'll be here to support you every step of the way. Until next time, stay curious, stay compassionate, and stay prepared.